Hi and welcome back to another video of Medic Notes. This video is on acanthosis nigricans. Acanthosis nigricans is a gray-black, papillomatous thickening of the skin at the flexor areas. It is usually symmetrical. It is most common around the posterolateral neck, axilli, groin, and abdominal folds. It is commonly associated with conditions like type 2 diabetes mellitus, obesity, Cushing's syndrome, acromegaly, malignancy, polycystic ovarian syndrome (PCOS), or other states of hyperinsulinemia. The mechanism is complex, with most cases occurring in the presence of insulin resistance. This leads to hyperinsulinemia, which in turn stimulates the proliferation of keratinocytes and fibroblasts. Hyperinsulinemia stimulates proliferation by directly stimulating insulin-like growth factor 1 receptors on fibroblasts and keratinocytes, causing proliferation. It also decreases the levels of some IGF-1 binding proteins. This causes an increased level of free IGF-1 in circulation, which stimulates the IGF-1 receptor on fibroblasts and keratinocytes, leading to proliferation. Other mediators may include epidermal growth factor receptor, fibroblast growth factor receptor, and androgens. Since this condition is associated with conditions of increased insulin resistance, let's look at the three types of insulin resistance. Type A is due to dysfunction of insulin receptors. Type B is caused by antibodies against insulin receptors, whereas Type C is due to post-insulin receptor defects. Any of these pathways may cause hyperinsulinemia and result in acanthosis nigricans. This diagram shows the pathway of how conditions like obesity, PCOS, Cushing's syndrome, and acromegaly leads to acanthosis nigricans. There is evidence that obesity is associated with dysfunction of insulin receptors, leading to a compensatory rise in insulin levels. So hyperinsulinemia. The high levels of insulin activate IGF-1 receptors on keratinocytes, leading to excess proliferation. In the case of acromegaly, there are two contributory pathways. Firstly, excessive growth hormone causes increased production of IGF-1, which stimulates the IGF-1 receptor on keratinocytes. Secondly, insulin resistance may be present, leading to hyperinsulinemia and insulin-based stimulation of keratinocytes and fibroblasts. That's all for this video. Thank you.